Heart disease is the #1 killer in the UK, with raised cholesterol levels one of the most significant risk factors. Now, 6 in 10 people in England have levels at or above the UK safe guidelines. But do we really fully understand the facts surrounding high cholesterol? I'm here in central London to find out what people know, whether they think they're at risk, and how you can keep cholesterol under control and keep your heart healthy. What do you know, if anything, about cholesterol?
It's when you eat like oily foods and things get stuck in your heart.
I know that it's something that clogs up your veins and pores.
Not good for you, fat, does your heart in, makes you ill.
So it's clear there's a bit of a cholesterol conundrum going on and a whole mixed bag of information out there. So I'm going to consult some experts and chair a panel right here at the Royal College of Physicians to get some answers. Doctors, scientists and nutritionists are making up the panel, and the audience have been invited to get their cholesterol levels tested and learn more about the best way to keep those levels in check.
Cholesterol is something that doesn't give you symptoms if it's in excess. So having your cholesterol measured and knowing your numbers is important.
What does the average person suffering from high cholesterol look like in the UK? A tough question, I know. You? Quite.
The first thing for us all to bear in mind is that about 80% of our cholesterol levels are already predetermined by our family history and our genetics. So we shouldn't feel guilty if we suddenly find out that our cholesterol levels are on the high side.
If your cholesterols are moderate, then perhaps eating more of the foods that are rich in beta-glucans is important, because we know that that can help to reduce cholesterol by preventing absorption from the gut. So do sterols and stanols in plants, but they're largely synthetic products. And I would always tell people to do what's natural first. Later comes medication.
We've known about the benefit for oats for many years, and there have been various claims about it being heart healthy for many years. What we have been able to do as a company is isolate the oat beta-glucan in a very pure form. If you were to eat a normal bowl of porridge, there would only be about 3% beta-glucan. The benefit of OatWell is that you're between 20 and 30%.
What are you personally hoping that people are going to leave today having learnt and going away with?
Yeah, well, I think the single biggest thing that I'd like people to go away remembering is that they can do something by changing their diet and lifestyle. That's very important for me, and you can make significant changes to your cholesterol level. And if all the population in the UK took this on board, you know, just a 5% reduction in cholesterol level could save 64,000 people from having a heart attack next year, which is absolutely fantastic.
Some fantastic advice there from Linda, some fantastic advice as well from our panel of experts. And of course, if you're worried about your levels of cholesterol, then why not make an appointment with your GP to find out more. But as Linda has said, it really is about those small lifestyle changes that really can make all the difference. And 3 grams of oat beta-glucan really is a great start.